Hi, my name is Jenny Zhao and I'm a P2 student at the UConn School of Pharmacy. Today I will be presenting about rosacea. In this presentation, I will go over the characteristics of rosacea and its prevalence. I will also discuss the diagnosis criteria of rosacea, the 4 different subtypes, and the different treatment options available. So what is rosacea? Rosacea is a chronic inflammatory disease that affects the central face region and the eyes. So this includes the cheeks, chin, nose, and forehead. It is characterized by recurrent flushing, erythema, which is reddening of the skin, papules and pustules, which are raised areas of the skin, and pustules have pus inside, as well as telangiectasia, which is when you can see the dilated or broken blood vessels near the surface of the skin. They are also known as spider veins. About 5.5% of the adult population has rosacea, so it is a pretty common skin condition. It can present at any age, but is more common after 30 years old. Because rosacea affects the face, it can be very obvious, and as a result, it has a psychosocial impact on those who have it. It can lead to embarrassment, a low self-esteem, anxiety, depression, and stigmatization. Next, we'll talk about how rosacea is diagnosed. Rosacea is not diagnosed based on laboratory tests, and instead the diagnosis is based on clinical observations and patient history. Clinical observation is divided into diagnostic, major, and secondary features, and we will go over these in more detail on the next slide. So there are 2 diagnostic features of rosacea, and at least one of them needs to be present for diagnosis to happen. One of them is fixed central facial erythema, which is redness in the cheeks, chin, nose, and forehead, and you can see that in the picture on the left. The second diagnostic feature is phymatous changes, which includes thickening of the skin and the appearance of a bulbous nose. You can see that appearing as rhinophyma in the picture. There are 4 major features, and at least 2 of them need to be present for diagnosis to be made if there are no diagnostic features seen. These include flushing, the presence of papules and pustules, telangiectasia, and ocular manifestations. Finally, there are 4 secondary features, and they commonly present with the other diagnostic and major features. These include burning or stinging sensations, edema or swelling, dryness, and ocular manifestations. Here's another picture showing the common features of rosacea. You can see the erythema or redness in the center region of the face, the pustules and papules, the telangiectasia, the rhinophyma, which is thickening of the skin around the nose, and the flushing. Next, we are going to be talking about the 4 rosacea subtypes. The rosacea subtypes are erythematous telangiectatic, papulopustular, phymatous, and ocular. While rosacea is split into these 4 subtypes, more than one subtype can occur at the same time, and the subtypes can progress from one to another. Subtype 1 is erythematous-telangiectatic rosacea, and the main identifying feature is the flushing and persistent erythema of the central face. The skin is easily irritated, so burning and stinging is commonly experienced. Edema, roughness, or scaling of the skin can also occur. Telangiectasia is also a common feature of this subtype. Each of the 4 subtypes has a severity scale of mild, moderate, and severe. Flushing and erythema is present in all 3 of subtype 1, but less frequent and mild, and more and moderate to severe. Telangiectasia also becomes more prominent as the severity increases. Severe subtype 1 is also characterized by edema, burning, stinging, and roughness of the skin. Subtype 2 is papulopustular rosacea, and the main identifying feature is the presence of papules and/or pustules. Persistent erythema along with burning and stinging are also present. Mild subtype 2 is characterized by a few papules or pustules and mild erythema. The number of papules and pustules as well as the intensity of the erythema increases with the severity of the subtype. Severe subtype 2 can also have burning and stinging sensations. Subtype 3 is phymatous rosacea, and its main identifying feature is skin thickening, which results in irregular surface nodularities and enlargement. It most commonly affects the nose, which results in rhinophyma. Other affected areas also include the chin, forehead, cheeks, and ears. Patulous follicles and telangiectasia are also possible. Mild phymatous rosacea is characterized by patulous follicles with no contour changes. Patulous follicles are follicular openings in the skin with keratinous plugs, and contour changes refer to skin thickening and enlargement of surface areas. Contour changes are only present in moderate and severe disease, and the difference between moderate and severe is that moderate subtype 3 does not present with nodules while severe does. Subtype 4 is ocular rosacea, which can have many different presentations. Some signs include watery or bloodshot appearance, foreign body sensation, burning, stinging, dryness and itching, light sensitivity and blurred vision, telangiectasia of the lid margins, which you can see the red arrows pointing to, a honeycrust, which is waxy buildup at the base of the lashes, and you can see the blue arrows pointing to that. Other eye conditions can result from ocular rosacea, and this includes blepharitis, recurrent conjunctivitis, styes, as well as a decreased visual acuity due to corneal complications. Mild ocular rosacea only affects the eyelid margins, so this includes telangiectasia and honeycrust. Moderate ocular rosacea affects the inner eyelid, tear secretion, and or the surface of the skin. So these can include watery or bloodshot appearance and foreign body sensation. Severe ocular rosacea is when it progresses to other diseases such as blepharitis, which can then potentially lead to corneal damage and vision loss. Next, we'll go through the different treatment options available for rosacea. There is no cure for rosacea, but you can manage symptoms with topical therapies, oral therapies, light devices, and lifestyle management, which includes skincare. Topical and oral therapies both treat inflammatory papules and pustules, and topical therapies also reduce erythema. Topical and oral therapies are commonly initially prescribed together in combination, followed by long-term use of a single product to maintain remission. Light devices are mainly used to remove telangiectasia, remove erythema, and remove thickened tissue and phymatous changes. Topical therapies, oral therapies, and light devices such as the ones listed here can all be used to treat erythema by decreasing inflammation and reducing redness. Topical promethazine and oxymetazoline are the most effective. For phymatous rosacea, there are two types: active phyma, which is inflamed, and fixed phyma, which is not inflamed. Both active and fixed phymas can be treated with light devices, and the ones listed here function by removing excess tissue, and this can help reshape a rhinophymatous nose. For active phymas, topical therapies and oral therapies can also be used, but in general, light therapies are the most effective. Combination therapy with topical and oral treatments are commonly used to treat mild to moderate rosacea with papules and pustules. Ivermectin, azelaic acid, and metronidazole are the most effective topical therapies, while doxycycline is the most effective oral therapy for papules and pustules. Telangiectasia is most commonly treated with light devices, but retinoids can also be used, although they should be avoided in pregnancy. Ocular rosacea can be treated with topical and oral therapies, as well as intense pulsed light. Good eyelash hygiene is also important to reduce waxy buildup at the base of the eyelashes. To do this, first use a warm compress to loosen up the buildup, and then clean the eyelash with baby shampoo twice daily. If any corneal ulceration, inflammation, or red eye is experienced, it is important to refer the patient immediately to an ophthalmologist because the condition is more severe. Although rosacea features can be reduced or treated with topical, oral, and light therapies, lifestyle management is key to prevent exacerbating symptoms. The main one is to avoid triggers, and you can do this by keeping a daily diary of what triggers the rosacea symptoms. This can vary from person to person, but common ones include sun exposure, stress, heat, heavy exercise, alcohol consumption, certain skincare products, and certain foods. And because sun exposure is such a common trigger in patients with rosacea tend to have sensitive skin, it is important to use sunscreen and gentle skincare products without any fragrance. Common drugstore brands that have products for sensitive skin include Aveeno, Vanicream, CeraVe, Cetaphil, and La Roche-Posay. It is also recommended to use products that have anti-inflammatory properties as they can help with flushing and erythema. Ingredients include licorice root extracts, sulfur, and aloe vera. A drugstore example is Rosacea, which contains sulfur to help reduce flushing and erythema. So the key point of this presentation is that rosacea is a chronic inflammatory disease that affects the central face region in the eyes. There are 4 subtypes, and they are erythematotelangiectatic, papulopustular, phymatous, and ocular rosacea. Treatments include topical, oral, and light therapies, which work by reducing inflammation, eliminating papules and pustules, and removing thickened skin. In addition to pharmacologic treatments, lifestyle choices are also key to managing rosacea, and that includes avoiding triggers, using sunscreen, and using gentle products on the face. So that's the end of this presentation. Thank you so much for listening, and if you have any questions, you can email me at jenny.zhao@uconn.edu. Thank you.